Welcome to the DrNursePaul Show, hosted by Aspire RN and Dr. Paul. You are watching the USA Nurse Series. Dr. Nurse Paul is an NCLEX expert, having trained and mentored thousands of international nurses past the NCLEX RN for over a decade. He graduated with a Doctor of Nursing Practice in Texas Christian University. He is a registered nurse, an advanced practice registered nurse, and a certified family nurse practitioner. He also has completed a certificate for nurse educator postgraduate course. Aside from teaching, he has extensive clinical experience in emergency and family medicine. He has over 15 years of combined clinical and academic healthcare experience. Dr. Nurse Paul is an immigrant from the Philippines. He is currently based in Houston, Texas, where he operates his business, Dr. Nurse Paul, and Aspire RN NCLEX Prep. He loves to share his life story of how he overcame his challenges to reach his dreams. He is passionate in helping nurses realize the American dream. So without further ado, let's all welcome Dr. Nurse Paul.
Good morning everyone. I'm glad to be back. I missed the show last week. This is Dr. Nurse Paul and welcome to the Dr. Nurse Paul Show. Today we're going to have the USA Nurse Series and I'm going to be talking about very important things that's going on with the international educated nursing immigrant community. And we're going to talk about nursing shortage. And because I'm also part of the retrogression several years back, I'm going to talk about that with my peers, Anna and Marvin. They're my regulars in the show. They should be my co-hosts at this point. Hi, Marvin. Hi, Anna.
Hi. Good morning.
Hi. We're all representing 3 time zones of the U.S., Anna being in New York and Marvin being in California, San Francisco.
Well, I'm in Canada right now.
Oh, Canada. I can't even predict where you are. Okay, where are you coming from? All right, but Marvin is our travel goals in nursing life. So very liberating to be a nurse here in the US because you can just travel on a whim.
Yep.
And
Marvin implied got me not permanent address.
I
Oh, yeah.
know
Yeah.
his
No
address is
permanent
not
address.
his
Oh,
address at all. I think his address is the San Francisco International Airport at this
that's true.
he stays there more than anywhere else. But thank you guys for joining. Last week I was feeling sick and I was in Seattle, so I had to what's this cancel the show. But we're gonna make that up next week because it's about nitrogen and NCLEX. And I'm currently sharing my sources to my peers right here. Let me guys share some sources to you guys, all right? Because this is what I'm gonna be reading today. But thank you for joining us. Please share this to your peers. We're going to be talking about a lot of things today. We're also streaming live, not only in my pages, but also in Aspire RN page. And we're also sharing this in Lefora Filipino Nurses to USA, the group that Anna and Marvin, alongside with me and our other admins, are managing. And by the way, before I proceed, this was going to be an announcement last week, but I'm taking this time today to thank my international educated nurse community and Lefora, of course, for bringing me to this spot. I was selected as an
Congrats.
inaugural board of director for.
Congrats, Paul.
Thank you. It's an upcoming organization. It's called Society of Internationally Educated Nurses in North America, covering both Canada and the United States. So, as an inaugural board, which means we're the founding board, it's a lot of work, it's a lot of commitment, but I'm up for this challenge. I'm here for the advocacy of empowering and supporting our IENs, Marvin, Anna, and myself, along with thousands of IENs, have been migrating to the United States for 75 years. But come to think of it, we don't have a national representation that will bring all these immigrant countries together in one umbrella. So this is why we have Sienna, and I thank the selection committee for at least reading my application paper. I didn't expect to enter the board. I was just honestly volunteering to be a member, but I got invited to submit an application, and the rest is history. And honestly, guys, I never realized that I would be one of the people that will be advocating our IENs. Um, I'm advocating for a lot of things, mainly for just encouraging people um, for pushing through with their American dream. Like I said, today we're going to talk about shortages, and that's one of the difficult things we're experiencing here in the States, right? And also retrogression. It wasn't an easy journey here to go here, but mainly what I do online was just to encourage people, and titles are really not needed to do that because I would still keep doing that regardless the disappointment. But disappointment is very much welcome for my professional career. It also solidifies my advocacy for the IEN community. And please support me and the board of the Siena Society of International Educated Nurses, Nurses in North America. If you guys can follow us in LinkedIn and Facebook, we're going to be having our launch very soon. I cannot announce it. I don't have the permission of the board to announce it just yet. But it is not, it won't happen if I didn't have the exposure and experience with managing Lefora. And mainly managing Lefora is more than clicking buttons and approving posts or filtering comments. It was more of our advocacy, all of our admins. I represent the Lefora admins in this society. It's a very prestigious society. But without Lefora, I wouldn't have this opportunity to really take the advocacy of Lefora to a national level, actually international, because we're
International
also
level.
including Canada. So thank you guys for supporting Dr. Nurse Paul. Thank you for supporting our admins in Lefora as well. All of these that we are doing are volunteer jobs, which means we're just doing this because it's just our passion. We knew how hard it was to be in a position where you're just waiting for your papers to come through. You don't even know when it's gonna happen. But rest is history for me, Marvin and Anna. we can honestly say, I don't know if I should talk for them, but for me, um, I thought when I was in the Philippines, I was an educator flying all around the Philippines and all the islands possible in the Philippines, teaching everywhere, all nursing students for the last 10 years before I came to the US. I thought that was the peak of my career, right? But I knew there was
More.
something more for me outside the islands of the Philippines. I love my country, but I know if I don't leave the country, I would be limited to whatever the country is offering. And I said to myself, let me try the global market. I might have a shot. I'm but a small person, not the smartest in the class, definitely not the best in my class as well. But I might have a shot. What I'm bringing into the global market is my passion. So that's what I said. And 6 years into the US, so many things happened. This is the fastest that my career has ever, I'd say, grew in the last 6 years. But hey, I'll take that as a challenge. All right. Sometimes I feel like everything's happening fast, but honestly, I didn't see myself doing this at this age. I was honestly planning to do this in, after 40, after 50. But I guess everything's happening fast, but everything happens for a reason. So I'll take that challenge. But thank you, Anna and Marvin. They're going to be
Yep.
sharing their experience today as well. You have something to say. Marvin is also very active in the nursing community, and Anna is part of the leadership
Yeah.
committee of the CNOR, and she highly advocates for OR nurses to be certified. Anna, right?
Ano ba? Ako na ba? Hello, good
Just about
morning.
our advocacy. I'm just touching through our advocacy right now.
I was so clear listening to your info, and congratulations again.
It's for Lefora.
Okay, so I'm gonna reintroduce again for your million viewers. I'm Anna Cruz. I'm one of the admin of Nefora, and I am based in New York. And like Paul said, I was once victim, no, not victim, once product of retrogression, and one of the admin who's very active, helping nurses to achieve their dreams. And sometimes I mentor the CNOR or nurses who want to take CNOR. And I work hand in hand with the brightest and happiest nurses on earth, like Marvin and Nurse Paul and Clay and Jean and May. So we are here not just to share our personal experience, but also to guide you and help you. But the number one person who can help you is yourself.
Correct.
We are just in the background. Because no matter how we educate you, no matter how we share or influence you, if you're not gonna move, or if you're not gonna decide, or you're not gonna do something about it, American dream will always be a dream. And you have to wake up. You have to wake up. Wake up, stand up. Don't think about the nightmares that you're creating around your head, like retrogression, NGN, IELTS. We're part of it. You have to wake up now. You have to make a plan and do not think about, I'm not saying do not think, but take the time. Because right now you're having a break. It's only a break. The retrogression is only a break. And there will always be nurses in need in the US. We have 3 states here. And nurses is the most rewarding and
Trusted
uh
profession.
yeah, respect profession, and they need a lot of nurses, not just to work in a hospital, but in school, in a clinic. And so do not be discouraged by this retrogression thing.
Thank
All
you,
right.
Anna. And Marvin is also an advocate for himself for the nursing community and certification programs. Marvin has a lot of
Yeah.
certifications. Talk to us about yourself and your advocacies, Marvin. Since we're
Okay.
talking about advocacy, it's an
Sure.
advocacy day today.
Okay. So good morning again, Nurse Paul and Nurse Anna. By the way, for everyone, wherever you are right now in the world, good morning, good afternoon, or good night. So my name is Marvin, and then I'm actually based in San Francisco, but right now I'm constantly traveling for fun and to see friends. I'm in Vancouver, Canada right now, still the same time zone, San Francisco area. So, what's this? That's true. I mean, piggyback with Dr. Paul and Nurse Anna. So I'm also an advocate for nursing education or nursing certifications. So way before when we were in college, we always see like every author has like a lot of titles in their names, and then I was just like fascinated about it. But behind those letters are actually responsibilities. So I'm active a member of Emergency Nurses Association. Same thing with Dr. Paul, and also American Association of Critical Care Nurses. Hi AACN. So for this year, I just want to announce that I was elected as the program planner for National Teaching Institute for 2024, which will be in Denver next year. So I'm happy because like I think I'm the first Filipino who actually like to hold that position, and at the same time I want to share all the experience coming from internationally educated nurses about critical care, sharing information and also the best practices around the world. So aside from that, as what Nurse Paul was trying to say, I value certification because those letters are actually responsibilities. With great letters comes with great responsibilities. It's not just like to show off after your name,
Mhm.
but it's a validation of your knowledge, and at the same time, it benefits you. It benefits the patient. Now, talking about retrogression, as what Nurse Anna was saying, you're having a break, and as I always try to inform my former students, my friends, it's not about denying your American dream. It's giving, God is providing you more time to prepare for something bigger and worthwhile. So that's my advocacy, along with Nurse Paul and Nurse Anna, as part of your Lefora admins, is to give hope, inspire, educate, and give you choices for you to become a better nurse, not just in the Philippines, but coming here for your American dreams. That's all for me.
Thank you, Nurse Marvin. And that is the truth. The bottom line for what Marvin and Anna is saying, and all my other colleagues that I usually bring into the show, is about pursuing the best version of yourself. It's all about excellence. Like, yes, we are nurses, but we have so much skills that we can bring into the table, such as what Anna is doing. She's volunteering online in these shows, in her posts online and what she's doing, and she's very open with her struggles with what she had to go through to go into the US, as well as Marvin, who's also is active in many different organizations and committees, coming from the Philippines, where we are a little country. Now we're in the international stage. That is
Mhm.
something that is very admirable, because like Marvin said, it's hard to get those spots. It's very competitive. You just don't get selected because you look cute in social media, or
Last point.
you have been a Lepora admin or something. But they check your character, what you can bring into the table, and also your experience and expertise. It's a very competitive
True.
environment. So for IENs to be securing these posts is really admirable. And of course, I always encourage our IENs to excel in whatever community they are placed in, whether it's their hospital or organizations. Hey, we're here to contribute to the betterment of healthcare industry, right? We're very much needed here.
That's true.
And Charles is watching us from Uganda today. Thank you, Charles, for joining. If you guys are joining us today, tell us where you're coming from. And Arlene said, congratulations. She's watching us from Jamaica. And Daisy said, in Filipino, she said she's really inspired with this talk. And that is why we're doing this show. Thank you, Daisy, for joining us today. If you guys are joining us today, put in the comment section where you guys are coming from. If you have questions, we can also answer you online. But the main topic for today is going to be all about the main topic that I prepared for today was nursing shortage. But Marvin and Anna and myself will also talk about our experience in retrogression. All right. Because yes, it's one thing to discuss nursing shortage, but the timing is a little off because people are going to be like the IEN community, the International Educating Nurse community is going to be like, well, if there's a shortage, why is there a retrogression? Those are two different things. We're going to
Mhm.
share you guys our experience later to kind of encourage you. And Pia is here. She's saying, hi, Anna.
Hi, Pia,
Fan
my
club.
workmate.
All right. And please share
Anna for
this
fan
and
club.
please share this to everybody and tag your friends too. Please share this on your pages. Good morning from New Jersey, Cecil.
Good morning.
Good morning. Thank you for watching our show today. All right, let's give a brief overview about nursing shortage. All right. Let me open my source so I won't so I'm gonna say factual things, otherwise it's gonna be opinionated on my part and I'm gonna be biased because I'm an IEN, something like that. I don't want that perception. So I'm reading off of the American Association of Colleges of Nursing, AACN. All right, their position statement or fact sheet about nursing shortage published in October 2022. Fairly recent. This is the most recent that I can find in a big organization such as this. The others are outdated. I was reading studies from 2018 and 2020, but the pandemic changed the landscape. So the more current the data, the better and more factual it is for me. And it said here, according to the Bureau of Labor Statistics Employment Projection 2021 to 2031, the RN workforce is expected to grow by 6% over the next decade. So the RN workforce keeps growing here in the United States. The workforce is expected to grow from 3.1 million in 2021 to 3.3 million in 2031. That's an increase of 195,400. The Bureau of Labor Statistics also projects 203,200 openings are in job openings every year. All right. So that's every year. Yes, we're producing nurses here. I think we're producing about 200,000 nurses every year here. But that's not accounting for the ones that are leaving the workforce because they are retiring. And when nurse retirements and workforce exits are factored into the number of nurses needed in the US. So there's a lot of need. And according to the Bureau of Labor and Statistics, they've actually said the same thing that we're going to need about 200,000 nurses per year, right? And this is projection. It can get worse. It might get a little better. But ever since I was a nurse in school, BSN started 20 years ago, everybody's just been talking about shortage in the US. All right. Our books are American books. So it's all about US books and
Mhm.
shortages and, you know, providing a clear path for nurses to finish nursing and not only start it but finish it, but just to increase the nursing workforce. And we're bleeding nurses, is what we say. There are so many patients coming to the hospitals right now. Nurses can keep up any unit. I mean, Marvin and Anna, we are practicing nurses and we see this every day. Like I said, I was asked in one of the shows, do you think there's a shortage? I was like, I certainly do. I've worked here in the US for 6 years as an ER nurse and multiple hospitals, more than I guess 15 at this point. But I've never been to a shift where we're complete. Probably once, right? But somebody
Yeah.
got sent home. I do not consider it as we're complete because as soon as somebody goes home, here's the surge in the ER and we're short staffed again. So something like that. I've never seen a shift, and it's actually just
Nurse Paul.
too. So something like that.
Pretty
I'm not sure about Anna's experience and Marvin, but it's evident on my neck of the woods. Wherever I'm working, there's always shortage. So I think it happens in the national level too. What you guys think about that?
Go ahead,
I'll
Miss
go
Anna.
ahead. So
Yeah, go ahead.
before COVID, before COVID pandemic, there's already been pandemic going on, which is the nurse shortage. And the reason why I became a nurse because when I was in school in Emilio Aguinaldo College, one of my professors said when I was in my second year, she announced that hey, there will be shortage in US for nurses, and that was 2000. So now it's already 2023. So this pandemic of nurses for claims has been happening for a long time. So where I am right now in New York, I work in the OR, and there's always a shortage. One of the most highest in demand as a travel nurse is the OR because of the nursing shortage. Especially when COVID happened, many nurses left because they don't want to take the vaccine. Some got burned out. And mind you, I'm already in OR. There's only one-on-one patient care, but still the numbers are rising. So where I'm right now in one of the biggest hospitals in New York, I stayed for a year. I'm a local traveler now, and for a year, we're always still in need of nurses. And I read one of the journal in New York that by 2041, there are gonna be like 40,000 more nursing shortage. So with this in me, there's a lot of jobs that I'm travel nursing will stay, hiring nurses from other countries like Philippines will stay, and but like all what said, retrogression is another separate or different from nursing shortage. So we have to wait until October for the retrogression or the latest news. So that's what's happening in New York.
Wow.
All right.
Thank you. Wow.
How about
Thank you.
how about Marvin?
Oh wow. Thank you so much for informing that, Miss Anna. So based on my experience, so I have to agree with Miss Anna regarding some of the reasons of the nursing shortage. Now ever since when like way be after graduation, I always like set my focus to work in the US because I think they need more nurses. So by the time I came here to the US, I realized the reasons why. So the past 2 years we have this great resignation, and then after a year the silent quitting. So when you say great resignation, some of the nurses actually from staff they went to travel nursing because of the luxury pay. I mean, we cannot deny that. I myself went into travel nursing the past year because I just want to try how is it. And then another reason is that there's some, I mean, the great resignation was due to a lot of factors. Number one, the cost of living is starting to get piled up, and then the other one is some internal conflicts that includes lateral, horizontal violence between staff, and then the working environment is not that healthy. So I even went to a facility that one of the educator was saying that, oh, by the way, during the past 5 months, I was training 150 nurses. And then I said like, wow, you train 150 nurses. And then when I interview a core staff, they said like, oh, like 80% of the staff quit because of this, because of they want to pursue a higher level of education, they want to pursue travel nursing, and they just want to quit because they burned out. So I said, that's a lot. I mean, like, including myself when I was there. So I said like, what's happening here? And then good to know that it's they blame it on the management, they blame it on the healthcare system, they blame it on like they're trying to bank more of the travel nursing travel nurses because like they're easy to pay. And wait, going forward, when I was sitting as part of the interview panel, I also realized that there's also lack of quality and trained nurses. So I interview hundreds and hundreds of nurses, and then we try to find the best candidate. And not all the the batch has the perfect candidate that you're looking for. Sometimes we're looking for trained nurses, and that's why Filipino nurses. I know most of us are trained, coming from different um, parts of the world, going to the U.S. But sometimes another thing is going on. They're being exploited, and sometimes they get burned out, and then there's another reason for that. So I realized that this is a constant pandemic that's going on, like the nursing shortage,
Mhm.
and I hope that one day we'll try through immigration, proper immigration, to based on quality education and also quality experience, we can able to um, provide better staffing for nurses because better staffing equals safety. But I guess this is just another California dreaming because at the moment, to be honest with you, when I'm working, we have always like trying to call someone to fill in the holes to make sure that we can actually like work efficiently with numbers in safety. Safety and numbers, by the way. So that's for me and based on my experience.
Right. Thank you, Marvin and Anna. And it truly is. There's a lot of shortages. I mean, even the International Council of Nurses, in their article about nursing shortage, claims that there is shortage everywhere
Mhm.
globally. I guess that's something to do with not only nurses leaving the bedside because of exhaustion and low
Mhm.
morale for our nursing community. So please thank a nurse if you know someone, because it's really very welcome right now. It's getting more challenging. I'm not gonna say difficult because we signed up for that and we love our jobs. We're passionate enough to do our jobs. Otherwise, we're not gonna be doing our jobs.
Mhm.
But it is proving to be very challenging. And I've heard reports. I don't have the data to support this, but I wish my researcher peers, maybe this is a call to action to research on this. But I want to see a data that has concrete evidence about the number of nurses that left the bedside in the last 2 years, especially during the pandemic, or I mean specifically during the pandemic, because there were a lot of nurses that have left the bedside, and these are not usually what we see as a pattern of people leaving the bedside are those nurses that have been in the bedside for 20, 30 years. Understandable because they're moving to higher position like leadership or administration or non-bedside tasks. They're still nurses. But now we're seeing young people leaving the bedside, right? They've gone through nursing school for several years and have to try to succeed in nursing school and pass their NCLEX, only to be, discouraged with, I guess, the healthcare environment that they leave in their first 5 years. And that's very alarming because if the retention rate of nurses at bedside is only 1 to 2 years after graduation or 3 years, then we're not only going to lose nurses, we're also going to have massive brain drain to the point that we're gonna have more new nurses than experienced nurses that will be guiding these nurses how to adapt to the healthcare world, healthcare job, right? That
Yeah.
we're doing because you learn a lot from experience
Nurse
as a
Paul.
nurse. Yes, sorry about that, Marvin.
Nurse- Sorry.
Yeah, no, you're good, good. Yep, but that's it. So there's really extreme
Okay.
shortages here,
Oh,
and it's
sorry
very
about
important.
add more what you're saying about young nurses leaving profession earlier, like 5 years.
Yeah,
So
yes.
actually, I did a study about bullying, and I think that yeah, I think that was my master's, yeah, that was my master's thesis actually. So 60% of new nurses quit the profession in 5 years because of bullying, and at the same time quality of receptors. Because in first thing, quality of receptors, most of the people who are there for like years and years with years and years of experiences, and also um, are equipped with the talent of teaching, actually quit. So because maybe because of other reasons, be it economical or be it like internal. The second reason is that most of them are now victimized by lateral violence, and at the same time, uh, there's there's even nurses. So those are the two significant reasons why some nurses of our generation are trying to quit bedside simply because they are bullied, and at the same time don't receive enough quality training. Just quit whatever was their goal, like objectively, or this is my idea, wasn't fulfilled simply because of expectations, and at the same time
Right,
poor teaching and also the working environment. So
right,
that's the
right.
that's the that's the re- my that's the result of my this.
I think we're losing you for a bit, Marvin. It's a little
Oh, sorry.
choppy on your end, but we got the gist of it, the what
Mm-hmm.
you're
Okay. Yeah.
saying. We still were able to made out what you said, but I think I agree with that. It's not only because the job is probably taxing, but the expectations of our baby nurses. And thank you for mentioning that research that you did, 60% of nurses leave the bedside in a couple of years after graduating and passing the NCLEX. That is very alarming to me because that means there will only be 40% of nurses that will be staying at bedside. Um, I do not want to be put in a position where I'm considered an older adult and I'm not receiving the care that I should be receiving, right? Because there's no more nurses in the bedside. And we're probably going to be told after 30 years by Chat GPT or AI to take care of ourselves, right? But
Oh,
yeah,
let me share with you my experience about nursing shortage. Not just a nurse, but as a patient. Two
right,
years
right.
ago, 2 years ago, I got sick. I got hospitalized. I was in and out of the ER, being admitted. I went for urgent care. So finally, 7 days, I was in the hospital. And I realized, now realize, like, to the highest level, how shortage of nurses really affect care. Because during those time when I was sick, I was not about to no bathroom privileges. Like literally, I have a big alarm, and that was like the not the height of the pandemic, but the end towards the pandemic. But there were no nurses, so I commend those who work in a medical surgical. I don't know how you do it, but those 7 days, oh, it's so hard to get sick when you're also a nurse and you know what's happening and there's not enough nurse to answer your call bill. You want to pee or you want to use the bathroom or you want the bed pad to be pulled out of your back. I've been waiting for half an hour and I try to be more compassionate and be more understanding of my co-nurses, but it's so hard. So now I realize, what if few years from now I'm gonna be a senior citizen and we have no more nurses to take care of us. And one time I had a one nurse who was just like of orientation, and I'm not trying to be hard on her, but I want to be healthy and I want to be out of the hospital. So I was like on top of her, asking about my normal values, about my meds, about my follow up. So and when I went home after 7 days, I realized that, oh my god, this pandemic of nursing shortage will affect all of us. Like right now, we're still young. I'm on 40, but what if 10, 20 years from now? Who can we rely on? These baby nurses quit and won't have enough experiences to take care of you. And my husband works in med-surg in ICU, and sometimes he got really upset with the new nurses from the ER. So, and most of the nurses find him very rude, but he was like, no, I'm not rude. I am just up for the patient because you forget this very important blood work, especially with the clotting factor, so it's sad, it's very alarming, and it's very scary.
Right. And thank you, Anna, for sharing that. It does really create a domino effect when there's a
Mm-hmm.
shortage. Like, for example, say there's a shortage in the ER, and that's just a very rare occurrence that ER is the only short area in the hospital. That can send heavy ramifications to the floors because now
Mm-hmm.
the floors would get patients with, just like what Ryan is having, patients with pending stuff that could be critical
Mm-hmm.
to their care, that could be very important at that moment because that's what they're for in the hospital. And I apologize for my ER peers, and I've seen this happen too. But like I said, and Marvin is also an ER nurse. It has something to do with personal competencies, but NCLEX
True.
validated them. But NCLEX
Mm-hmm.
only validates you as an entry level nurse, right? When you get
Mm-hmm.
to the ER and you get these high acuity patients with multiple diseases, nurses need to be proactive and one step forward is what we say in the ER. Like, you should be seeing that the patient is coding an hour or 2 or 3 hours before the patient actually codes because you want to do something
Exactly.
about that. But those things you don't learn in school. Those things you
True.
learn by experience. I've been an ER nurse for years, but did I learn that on my first day in the job? No. But thankfully, I had support of nurses trying to guide me through and saying, you know what? Your patient don't look good. You want to do something about that, reassess and call your doctor. And sure enough, 2 hours later, patient's coding, right? So something like that. Imagine if all the experienced nurses leave the bedside, right?
Mm-hmm.
It's such a scary thing for me as an ER nurse. And I'm only looking at the ER lens because that's my only experience in the hospital. But come to think of it in a general, in the bigger picture where OR is short and we have trauma cases from the ER, right? Where
Exactly.
floor nurses are short and now patients have to stay in the ER because there's no nurses upstairs. Or even, patients getting moved all across the hospital system too fast because we just need to make more beds in the ER, and now patients are going upstairs without proper endorsement, reporting, and also finishing the tasks that should have been done before the patient got admitted. So it sends really a domino effect to everywhere, and it's only in one local hospital that I'm talking about. Anna's talking about Marvin, but let's put it in a general scope where we're talking about all the
Mm-hmm.
hospital systems in the nation and across the world. Nursing shortage does really affect the whole healthcare system. And as a matter of fact, we are the most number of healthcare workers in the world, right? So impair the nursing workforce, you impair the whole healthcare workforce.
Mm-hmm.
So I guess the people above us, above our paychecks, should really start looking into it and really need to pay attention because we're losing nurses by the minute. And we're not talking about nurses retiring. This is like an early retirement thing where everybody just wants to get out of nursing and do business and totally forget healthcare. Imagine training for being a healthcare professional and forgetting it entirely or trying to move somewhere else. So that's very alarming. And that's something that we really need to talk about more, and that's why there's a lot of job offers right here in the
Mm-hmm.
US. It's crazy, like literally I call nursing as a financial literate
Cash
myself. I
cow.
call nursing a recession proof job, right? Because
True.
I was telling my friend if recession hits, all right, but I'm not saying it is gonna hit, but there are many signs that it will. It should have hit a year or two ago. And with recession, people lose jobs. That's the truth, right? But should I lose my job right now? What I'm doing? All I gotta do is go to the bedside. There's so many hospitals right there.
Yeah.
Drive an hour or two, or like 10 minutes from my house. I'm in the med center in Houston, Texas, something like that, but there are so many jobs and they're not going away. That's why we are outsourcing to international recruits like us, right? I was once a recruit, but now I'm contributing to the healthcare industry here, as well as Anna and Marvin, bringing all our experience, expertise, and passion and advocacy to the table. And so that leads us to our next topic. We need a lot of nurses here in the United States. I was actually
Sure.
We
talking
need.
to many
I'm
recruiters.
here.
Yeah, right. Many
Please
recruiters
do.
over
Please
the last
apply.
2 weeks because I keep trying to get their pulse. What do you think about retrogression? There's still thousands of jobs open, not only for local
Mm-hmm.
nurses but for IENs. The local spots that cannot be filled in 10 days by rule of the feds will be offered to IENs. And there are jobs that have been open for 30, 60, 100 days. You can check Indeed and LinkedIn and
Oh yeah.
Glassdoor.com. So many jobs that have been open for months. And that will be spots that can also be offered to IEN. So there's so many jobs, so many recruiters right now. But all, of course, let me put a disclaimer there. There's good recruiters
And
and also bad
very bad
recruiters. Right?
recruiter.
Yeah, let's
Not
give
bad.
them right, right.
Very bad
Yeah.
recruiter.
So
So just be
that's
careful.
the truth. So be very careful with who you talk to as well.
Hmm.
All right, but yep, there is an actual shortage. There's these jobs won't be open if it will not if there's no shortage here in the states. Considering we were talking about it in LinkedIn, I was in a conversation once. Considering that we're producing 200,000 nurses here in NCSB and pass rates here in the US every year, we're still short, right?
Yeah.
That's because of
Mm-hmm.
the great resignation. And one of our watchers is saying it's what's the main cause of nursing shortage? Um,
A lot of
there are
factors.
it's actually
A lot.
multifactorial,
Yeah.
right?
Mm-hmm.
We already talked about main points earlier, but I'm encouraging and inviting my researcher peers, my um, those that have love for data and research, maybe it's high time for us to collaborate. I'll collaborate with you. I'll write papers with you, but we need an evidence, a data that supports our claim that there is actually a shortage. The articles written by AACN and BLS are coming from national data from labor and
Mm-hmm.
statistics. But what's the pulse of our nurses on the ground, right? So Marvin commented about his research one time, but we need more of these papers to be written. Honestly, we
Yep.
need more papers about this to be written, and that's because we want it to be evidence based. That's the only way we can prove our point. Is what we say.
Mhm.
Otherwise, everything's gonna be opinionated. But Anna, Marvin, and me probably touched 10 points of
Yeah,
shortage, right?
almost.
Like training, right? Preparation of nurses, low morale,
Mm-hmm.
expectations,
Bullying.
salary,
Bullying.
bullying
And there's
in
one
the
more, Paul.
workplace. Yes.
Sorry, there's Paul. There's one more because like I actually like I'm doing like a per diem job for this certain hospital, and then this hospital I was surprised that they have this travel nurses eradication program. They want to get rid of the travel nurses. I said like,
Right, right,
hey, you're already short staff, and I mean, the open spots were trying to be filled by the travel
right,
nurses, and now you are trying to pick them out. I said like you're not helping the shortage, but you're actually
Yeah.
making it worse.
not
So
making it
and
work.
then yeah, and then like when I was like when she actually showed me the board, she said like, oh, those names there with an X, those are travelers, and we just want to get rid of them by the end of the month. I said like, oh my God, what will happen after next month where there were no more travel nurses? So it
Right,
adds up to another um cost why there is nursing shortages because
right,
like
Mm-hmm.
some of them, especially, I think they're pressured by the management because like travel nurses are very expensive, but it
right,
doesn't answer. I mean, it doesn't actually help the nursing shortages. It gets worse.
right. That's the truth. And as a travel nurse myself, we're all travel
Mhm.
nurses here, right?
Mhm.
Because
Yeah.
that was a trend after the pandemic. But even then, before the pandemic, I was already seeking jobs for travel nursing because I was gonna finish my job with my employer that brought me here to the US. But come to think of it, I've heard chatters where travel nursing is increasing the financial burden to the hospital. I always say, like they say it in America, don't shoot the messenger, right?
Yeah,
I
Yep.
true.
am but a product
Definitely.
of the healthcare industry. I'm part of it. So the complexity did not start with me as a travel nurse,
Mm-hmm.
and I'm sorry that you have to shoulder that cost. But on a perspective of an in-demand worker like myself, like Anna and Marvin, if I have to drive for 2 hours to be paid 3 times more than I'm making in this hospital, let me tell you this: I will drive 2 hours, right?
Hmm.
Because it's
Mm-hmm.
a supply of, it's a law of supply and demand,
Yeah,
basic
Exactly.
macroeconomics, and that's not even in nursing alone. I mean, if this were to happen to another industry, I'm pretty sure it will also show the same pattern. So it is antithetic for hospitals to say we're gonna let go of all the travelers, but there is a reason why that spot is taken by
Why
travelers,
we're here.
because that spot
Mm-hmm.
has been
yeah,
open for a bit, right?
yeah.
I guess, and I'm gonna challenge this with this. I'm gonna be putting it out there. I guess a lot of people at the top, the hospital administrators, are scared to actually do research because it might reflect things that they don't want to hear, that they don't want to talk about,
Exactly.
right? But
True.
I'm encouraging my nursing peers, if you want to collaborate with writing papers, but I want to survey the nurses themselves. Let's take it from the people that are actually doing the job to see what they feel about the nursing career right now. And we're not doing this as a political agenda activity,
Mm-hmm.
but we want to see what the nurses feel about their jobs right now. And how can we make it better? Let's start with the nurses. Let's bring in to the table, right? Like we cannot be
Yeah,
talking about nurses and the plight of nurses and shortage, but the actual people that are at the bedside doing these jobs are not even included in the talk. It's like telling
true.
me, oh, let's talk about how to solve this problem, and the people who's actually experiencing the problem are not there in the
Exactly.
meeting, right?
That's
So
true.
um,
Exactly.
that's it. But shortage is real, very, very real, evident everywhere. I mean, if you just look at our international Facebook groups, I mean, nursing groups that we join here in the US, we're not even members there, but we just silently follow to see what's going on.
Watching. Yep.
Sometimes we participate in their Facebook conversations too, travel nursing groups, nursing jobs here in the US, and so many others. you really can tell every day there's a nurse that's moving around, going somewhere else because the job didn't suit them. So something like that. Or hospitals that are making it worse for nurses to
Mm-hmm.
experience. I mean, to instead of focusing on their nursing responsibility, they're focused on something else, like collecting Google reviews from patients, which should have been a job for the marketing department and not nurses. Because we were trained to be nurses. Nurses like to be nurses. That's the truth. Which means
Mhm.
if I'm an ER nurse, I want to be an ER nurse. I don't want to be a transporter where all I do the whole day is to bring the patients up to 27th floor in building number C, where I have to take multiple elevators. And we're talking about Houston. I don't know how it is in New York City, right? But I've worked in the med center here, and I'm like, I cannot do this because
That's
I
why
want
I
to be
stay in the
here.
OR. I'm not going outside, Paul.
Or nurses are so spoiled because they're locked up in their own little cave in there. But ER nurses are something else, right? We are transported sometimes. But I mean, do I like to be transporting patients? If I'm that nurse that says, "Hey, if you're paying me 100 an hour to transport patients, I'll do that." But guys, I'm losing my skills if you make me do that. That's out
Right.
of my job to be rolling patients up. I would rather be at the bedside, helping patients, assessing them, making sure they don't get to situations where they're coded, or actually finishing my tasks for the floor nurses to actually focus on their tasks instead of catching up for me because I missed my
Mm-hmm.
meds, or I missed my lab works, or I missed a significant critical diagnostic result that just came in that I should have called the doctor for. The doctor could have
Mm-hmm.
seen the patient already. Something like that. Nurses like to be nurses. But
Mhm.
if you give nurses more responsibilities like administrative tasks, like, like do this and that, how about you chart more and do less patient contact? I would rather be at the bedside talking to my
Me
patient.
too.
They
Mm-hmm.
appreciate me for myself in my own personal experience when I talk to them and guide them through what's going on in the ER versus only seeing me at the beginning and at the end when they're going up, right? Like, of course, I'm not gonna like it either if I'm the patient and I'm stuck in the room for 6 hours and nobody's telling me what's happening, right? So that's it. But there's a lot of hiring in the US, lots of recruiters. And now let's talk about retrogression. Let's move to retrogression.
Sure.
Oh my God.
Right? And we're running over time today, but this is such a
It's okay.
very important topic. Thank you, Marvin and Anna, for sticking with me. But retrogression is happening, and we've talked about this multiple times in social media because we're running out of visas. While there's a shortage in the states, the visa control is towards the National Visa Center and U.S. Citizenship and Immigration Services. That's a federal government agency. Those are federal government agencies. Not even the president of the US can control that agency,
Mm-hmm.
right? So, yes, we need nurses, but we need to follow the rules. And the rule
Mhm.
says we can only give so much visas a year. And unfortunately, when that number runs out or about to run out, the NVC, the National Visa Center, USCIS, you know what? We're going to control the visa numbers now, right? We're only going to give visa numbers to certain people and not to everyone who's applying. So that's what retrogression is. Now,
Mhm.
for the rest of the world and the Philippines, because we're Filipinos, right? And majority of the immigrant nurses are Filipinos. But for the rest of the world, everyone that applied for petition and has been approved for petition from June 1, 2022 and after will have to wait. They don't have
Mhm.
a visas available for you guys. Visas are only available for people that have had their petitions approved, or we call it priority date, from May 31, 2022, and before that. And when I say before that, somebody would ask me, I have a priority date 2019. Am I included? Yes, that's called
Yeah.
before May 31st, 2022. All right, so your visa is secured. You're part of the numbers. They already counted you as deserving this visa. So you're part of the numbers that has been counted to receive the visa, even if it takes you another 2 years to apply, because you're part of it, unless the retrogression moves backward. And there, I had a question also online: is there a possibility for the next month's visa bulletin for July or June to move back? The answer is yes, because imagine before May 1, thousands of nurses are gonna flock the embassies to try to get visas, right? Because they're
Mhm.
gonna be running out of visas after May 1. They're gonna lock it out to only before June 1, 2022. So those nurses that are close to interview are gonna get interviewed. They're still gonna get more visas, right? So say for example, we lose more 1,000 more visas. that priority date might move back again. And we've seen this pattern over and over again. And somebody said, can you predict what's going to happen? You know what? Before I say my own prediction, because before we like to predict, I don't know with you guys,
Yeah,
before
I forgot. Yeah.
we do these numbers. How many did get their interview dates today, right? Or how many get their
Mhm.
visas this month? We write it down. But I want to check the pattern first. If it's going back for 3 months, then we're gonna keep going back. If it's going forward in the next month or two, then that means there's more visas available. They're just holding it. But I agree with Chris Musillo. I was in a show the other day with him last Monday. And I like Chris because I've always read his blog about his predictions, and they were mostly true. He counts them. His
Mhm.
prediction
Me.
is because he counts all the visas that are released every month. He has people counting them, and he knows the counts, right? I agree with him when he said he doesn't think it's going to get better until the next fiscal year, which is
Mhm.
October 1, 2022,
Over.
where we get another fresh 144,000 visas for
Mhm.
all categories. We're going to have to wait till then, all right? But Anna and Marvin, talk to me about your retrogression experience. Yes, American dream is real. Yes, we've been here for several years. We're all American citizens at this point. But tell us about your experience, the grueling experience, the hope that you
Grueling.
thought was lost, right? But looking back, right? Everything happens for a reason. And I want to talk about that because I want to encourage our nurses.
So,
Ladies first.
Yeah, go Anna.
ladies first. Okay, so I graduated 2003 with my nursing, with my BSN from Emilio Aguinaldo College. And then the moment I took my nursing license for after a year, I took the CGMNS test. And then I took my NCLEX from Hong Kong. So my legs for now. Wait, give me 1 second. So I waited 8 years. 8 years. On top of having a lot of issue with my speaking problem, with applying NCLEX. We have no NCLEX before in the Philippines. It's in Hong Kong. So
Saipan.
yeah, so it was a lot. And then before we have no social media, there's not a lot of options which agents to apply. I have to buy a newspaper every weekend, like Manila Bulletin and Star, and I have to cut the advertising portion, and I have to look all the agents who's hiring. But before I apply, I made sure I already passed the CGMNS test before it was accepted to be applying for applying for going to the US. And I finished my NCLEX in Hong Kong, and then I took my IELTS. I asked it first, twice first before I had my visa screen. And when I was in this agency for 5 years, I thought we were getting stronger, but then they abandoned me because of retrogression. So I was heartbroken. I cried. I was upset, just like the nurse is experiencing right now. Did I lose hope? Never. Never. What I did was to move on and to look for another employer that will capture my priority date. But the second agency abandoned me again after a year being with them. You got telling me, they just left. You got telling me, hey, we can't wait any longer. So that was my retrogression story from 2005 to 2007 to 2018. So I waited 8 years. On top of that, I took IELTS 5 times. I renewed my visa screen twice. And originally, I am a California passer, but then I have to endorse to Vermont because I have no social security. And then later on, Vermont asked for social security, so I endorsed to New York. That time, they're asking for CBS New York. So imagine how much money I owe, how much money I spent for all of those paperwork. I'm already spending dollars and I'm only earning pesos. So while waiting, I had a love life. I got married, and then I had a child. Best thing ever while waiting for 8 years. So I met this man from a hospital, and then we got married, we have a child, and when he went to Kuwait to work as a nurse, I was eager. I want to be there too. You know, if we want to save money, as pocket money in preparation going to the U.S. But he said no, just wait in the Philippines. Go. So I work as a nurse and an OR nurse, and I work as a part-time clinical instructor in the OR. And the only thing that I regret while waiting for the visa or the progression family, I wish I learned how to drive. So for those nurses who were like upset and losing hope, make use of your time. There's so many things to do. One nurse sent me a private message. So Ma'am Anna, now it's for progression. So what now? So I told her, what now? There's so many things to do. Learn about IRS, taxation in the US. Learn about the insurance in the US. If you have a kid, if you're a mom and you have a special kid, learn about the available help that you can expect here when you come. The school district, the environment, learn how to drive. If you have a spouse who's not a nurse or who are not in a medical field, learn something new. You know, be a mechanic, be a carpenter. Most people get paid per hour here, especially in New York. You know, construction worker, you know how much they get paid here? $200 per hour. So for those people who are waiting in line or who are taking a break because of that progression, do not lose hope. Make use of your time and do not stop whatever you're doing, reviewing, sign up your aspire, take your NCLEX, you know, prepare for your English test, learn how to drive, learn how to cook, learn to do more side hustle while you're here. So people are frustrated, people are like, oh man, maybe it's not really for me. American dream is for you. Not just because there's a retrogression you're gonna stop. Just remember my story. Retrogression is not the only that holds me up. There's so many things that happen. I have family issue, you know, my brother committed suicide, my mom and my father they got sick. I'm the only one became a breadwinner and have the family while achieving those American dreams. So don't worry, by October, let's see what will happen. For now, take a break. I'm not saying relax, but do whatever you're doing, review, take the test, continue to interview the agency, look for a better one. You know, agency shopping, what we call in Elafora, right,
Yeah.
Marvin?
Yes, that's true.
And
Wow.
That's
Thank you.
a
That was very inspiring.
very long journey, but very worth it, Anna.
Mhm.
I mean,
yes,
I
Yeah.
mean,
yes.
seeing you right now and how happy you are with your life, with your
Mm-hmm.
husband Ryan and your daughter, truly a blessing that you
Correct.
didn't give up, right?
Mm-hmm.
It was very difficult coming over here. And you know what? The best part is coming over here, arriving day one, and we're green card holders because that counts
Oh yeah.
against
Mm-hmm.
citizenship if
Mm-hmm.
that's something you really want.
Correct.
And citizenship is a lot of opportunities in the sense that you can live, and thrive in the community where you're at right now, instead of just moving around because you're not a citizen or a permanent resident. So I guess that's a lot of
Exactly.
benefit as well. But I can honestly relate to you. I'll tell my experience later. I'll
Yeah.
defer first to Marvin because he has his own mountain that he climbed to get
Colorful,
over here.
yeah. Marvin has a colorful
I wish Yanni
experience
was
while
here too. I
waiting for
contacted
that
her, but she's still
progression.
sleeping. She's in San Francisco too. But
Okay.
I was trying to bring in people that have like retrogression experience because
Mhm.
I think we are the retrogression experts at this point because we've lived
Yes.
it. The people didn't know when I attended the show that I've lived through a retrogression that was much more than this. And they were surprised. Oh, he did? I was like, yes, actually, my post in Leforia, you can still check from 2017 when I
Yes.
got here and it
Mm-hmm.
talks
Yeah.
about it. But Marvin,
Yeah, sure. Okay. So I started my nursing career 2005 when I graduated from Western Mindanao State University. Hi, hi, Wimsu, or Crimson's High. So 2005 was then the year that I decided, like, hey, my goal is to work in the US. And then I took the IELTS December 2005. And then by May 2005, I took CCFNS in Cebu, and then 2006, and then after that, I found this agency that promised us to work and at the same time study in the US. And then, fortunately, I passed the NCLEX in Saipan June of 2006. Now, by the time I was in the agency, they were saying like, "Hey, do you want to be a student visa or an immigrant visa?" But I don't have any knowledge with that because my mind during that time as a 21-year-old was just like having fun. So I was like, "Hey, whatever the group is deciding, then I'll go with the group." So and then they decided like, "Hey, let's do the immigrant visa route." So a month
Mhm.
after that, retrogression started. And then I said like, what retrogression? I said like, oh, they're slowing down the visa because they have priority dates. Oh, since they already stopped like this month, most probably next month. So I was still very, very hopeful. Months turns into years, and then years turns into like almost eternity. So I waited 8 years. So from 2006, I said like, okay, let's wait. I did volunteer jobs. 2007, when I represented the Philippines, I like let me put my nursing career on hold. Let me represent the Philippines, do this international exchange, and then I just want to have fun while traveling. So nursing was out of was in the closet right now, closed for the meantime until like I'm doing this youth volunteer stuff. Thereafter, 2008 came back. I said like I need job, but during that time from year 2005 2006 there was a boom in nursing in the Philippines, and then they were looking for a clinical instructor. Lo and behold, I was able to get a job as a clinical instructor. So I stayed for clinical instructor to 8, 9, 10, and then because like I was promised like, hey, most probably your papers will be like the next and all that. You know what? I heard a lot of pressures like coming from the people close to me or like not even close to me say like, oh, I thought he's going to America. He's probably
Mhm.
lying. So I was like,
Yeah.
ouch. I said like, yeah, I mean like we're not in control of the visa. I'm like I have an application, I can show it to you, but like I cannot give you the crystal ball, a very specific date that I will fly to the US. And that reason alone, because of that, I was not promoted to a regular faculty because they say, oh, you have an application abroad. Most probably you'll be flying next week or next month. So just give it to someone who is like here or has this no American dream. I said, oh, ouch. So, so 2011, I said like, okay, because like the bills are piling up, and then like I know I'm very passionate to teaching. I love to teach. I love the academe, but one friend told me like sometimes your passion cannot pay the bills. Like, ouch, that's true. And then so I went to the Middle East, High Sheikh Khalifa Medical Centers. I went to Abu Dhabi. I was there for 3 years, and then by 2013, I received this email coming from NBC. I said like, "Hey, you will be having an interview." I said, "Oh my God, this is it!" But of course, I need to retake my IELTS because it keeps on expiring, and then I have to transfer my case from Philippines to Abu Dhabi because like I heard already horror stories in US embassy here in the Philippines. So I said like, oh, let me change that to Abu Dhabi, and then like I waited for about 2 months, and then I did my medicals, and then IELTS and everything, visa screening. Lo and behold, I'm here in the US in 2014. Now, as what Anna was saying, I have to agree that there's also regrets. So I have to agree that if given the chance while waiting for retrogression, I could have honed my skills, especially those fine skills like cooking. I hope I was prepared like doing the IRS, driving because like to be honest, like my
Guessing
hospital
up.
and my accommodation is just like one stone throw away, and the gas there is more expensive than 1 liter of water. So like I could have just like started driving. I could have like started cooking, like doing this finer stuff. Um, and also one more important thing. I hope I could spend more time to the people who actually matters the most. Because like to be honest, when I went into the US, it's hard
You're making me
because
cry,
I
Marvin.
sorry,
know.
because
Thank
it's hard
you.
because like
Yep.
it takes like seniority for you to be given the months or weeks that you wanted to go, like
Right.
especially December. Like December for us is one of the fun most
Most
memorable months
festive.
of the year because that's
Mhm.
the one that you really wanted. But since you are like under, I mean like low below the barrel, so in seniority like you cannot get that. So I wish I could like spend more time and not neglect, I mean not like disregard the people around me, because like if in case something might happen to them, it might be the last, and then you know what will happen. So
Oo.
those are my regrets. And a lot of people actually messaging me like, "Hey, this retrogression already. What else can we do?" I said like, have fun, trust the process. Like have fun when you say like spend time with your family, spend time with your friends, because by the time you'll be in the US, it will be difficult for you to just go back in 1 second and then like like feel them, touch them, say the things that you want to say to them. So and then at the same time I was telling them like, hey, if you want to pursue your master's degree in the Philippines, or if you want to hone your skills, do it. Drive and then cook, because like by the time you're in the US, no one will cook for you. Most probably your best friend will be Uber Eats or DoorDash,
Yes,
but
Right.
those are not the
DoorDash.
healthy stuff, and
First world problem.
yeah, these are all expensive things. So and also it's not all the time that you have a bus or a taxi or an Uber that's readily available. You need to learn to drive. So yeah, sometimes there are things that you have to do it on your own. You should not
Mhm.
rely it to someone else. And also equip yourself with knowledge, especially with IRS. Because when I went to the US, I was just like, here I am, happy-go-lucky guy, thinking that this would be like, oh, the best, no
Walk in the
struggles,
park.
less problems. Yeah, walk in the park. But honestly, there were struggles in between. To be honest, like since I was not an experienced driver during that time, I wrecked my car within 3 weeks. So I said like brand new car and then wrecked within 3 weeks. Lo and behold, my insurance went up. So and then like I was fighting with insurance, like, hey, how come it's like this? How come it's like this? Sometimes the things that we don't know is the thing that scares us. So
Yep.
sometimes take this time, this opportunity of retrogression to like learn more about the US, learn more
Right.
about the place, learn more about the things, learn more about the things that will propel your career. Now, this is not denying your American dream, ladies and gentlemen. This is not. This is just giving you an opportunity to prepare yourself to something bigger in the future, and that's your
Right.
American dream turning into reality. So that's my best advice.
Thank you, Marvin.
Yeah.
That was very I like listening
Nakakaiyak
to
naman.
I thought I already know a lot about you guys, but listening to these stories firsthand myself makes me also reflect about my journey. You know, like these are very important things that we're raising out there because these are personal experience of nurses that live through it. And thank you, Marvin and
Mhm.
Anna, for what my therapist would say for being vulnerable today, right?
Yeah.
So these things you can keep to yourself, but we share it out there not because we want to be emotional, but we want to be
Mhm.
able to share to you
Mhm.
the things that are going on behind the scene. That we're not only here because we're living the American dream. There are so many griefs and pains and scary moments and fears and anxiety that was enveloped through it, but we survived and lived through it. So if we can do it, we're very much humans like everyone else. Maybe there's a lot of fans for Marvin and Anna. I
Mhm.
know they have huge following, but guys, we're humans. We're capable of feeling these things. We're not invisible. We're not immune to depression and anxiety and feeling of fear and uncertainty and doubts and certain stuff like that. I had my own piece of the story. I finished nursing 2007, took my NCLEX shorty after getting my Philippine license. So 2008, I passed my NCLEX May, and I found employer. I chose between three or four employers at that time. They were competing for nurses because at that time there were so many nurses trying to go to the United States. So I got that one that will pay everything except my NCLEX, but I already passed it at that time. So I passed my NCLEX May 2008. That's been a long time, huh? You can tell my age, huh? Um, and August 2008, I was hired by this employer. I didn't sign the contract right away, guys. I took my time, and that was 2008. Still rings true today. I went through five employee interviews or employer interviews, and I read my contract and rescinded some of them because I told one of the employer, remember, why would I pay you $2,000 to get me to the US? I thought nursing is in demand, right? That was just a question. And she's like, oh, we're signing her offer. I was like, actually, I was not interested to sign the offer anyway, but a little, my smart mouth sometimes gets the best of me, huh? But August 2008, I was interviewed by this employer, signed the paperwork while you're in the Philippines. While they were in the Philippines recruiting. And it took a while because it's a small employer. It took a while to get the PWD. It's a labor paper that says, okay, this job's not available to anyone else, or this is what you're gonna make. Prevailing wage determination is what they call it. It didn't arrive till April 2009, the following year, and I got my priority date shortly after that. So I think that was June 2008 was my priority date. Um, so that 2009, that was what I'm saying. But at that time, it was retrogressed to 2005. And then shortly after that, back in 2009, 2010, the retrogression went as far back as 2002. I'm not sure if it actually went back to 1990s. I'm trying to recall, but I don't want to live
Yeah,
through it again.
1999.
Right? 1999. I remember
1999.
because I was
Yep.
like, oh my God, I'm
Yeah,
10
yeah.
years away. Like, what is my shot to the American dream at this point? And it went back as far as 2002 and then become unavailable. You, for several years, it was
Mm.
you, which means there's no visa that will be handed out to EB3 categories for Filipinos and for many parts of the world. There is nothing left. It's several years backlog, more than 10 years. We're not going to give any visa at all. All right. So that was it. Imagine you passing everything and getting told, well, we need you, but sorry, we don't have a visa available. So you're going to have to sit out and probably leave your American dream to dust. Like, bye. Right. We're done with that. Right. But you know what? I thought of it as this way. I always try to look on the positive side of things. It may be hurtful at the beginning, but if I focus on the pain, that's not going to bring me forward. You know what I said to myself? That's my retirement plan. America is going to be my retirement plan, right? It's going to come in. Pretty sure it will because my visa has been approved already. All I'm waiting is for Visa Center to clear me and they have visa available, and I'm going to get there. It might take 15, 20 years, but I know it was coming. You know what I did while waiting? I honed my skills. I did what I love doing, which is doing ER on the side, but also teaching. And I developed myself to where I'm now more responsible as a professional, more responsible with carrying myself professionally, and also learn to manage my money correctly, right? And 2014, I was about to become current, and my recruiter said, "Hey, hello, it's been years, but you're about to get current. How are you doing?" I was like, "Oh, I'm not in the bedside right now. I'm teaching already." And they said, the hospital didn't like it. They abandoned you. Imagine
Oh my
getting
God.
so close to getting visa, and they said, "We want you at the bedside." I was like, "Okay, but in the Philippines, it was review season, so I couldn't quit because I have 2 months schedule in advance, and it's already been booked, flights and all that, right?" Um, and I said, "Can I wait for about 2 months and I'm going to go back to the bedside?" But they said, "No, we can't. We have to move on to the next candidate." Imagine after waiting for 2014, this is 6 years later,
Wow.
8 years later, say, "We're going to abandon you," which means we're not going to proceed with our offer. All right, so I was distraught again. Like, you're getting close again. I totally forgot about it. It's like feeling like I already moved on, and then you called me that I'm about to get there, and then you tell me, "Oops, hold on, there's a mishap. You're not gonna get there actually because they just
Paasa.
fired you. You're not even there. You haven't even started working. You got fired already." Kind of that feeling that I was like, "Ooh, what is this emotional effect that is causing me to feel like rejected? I haven't even proved myself worthy, right? Something like that." So what I did was ask my employer, "Can we find another employer? Or if not, you can release me. I'll find another employer." And she said, "I have another employer that's willing to interview you and wait for you to get to bedside." And I started doing bedside again on the side. And they interviewed me. I got hired March 2015 again by this new employer. My priority date got recaptured, so I didn't have to go back to the line. And then I was about to proceed because now I'm getting current. My visa is current at that time, right? I have the visa allocated for me and I could proceed. But as soon as I got the job offer and the recapturing paper, well, guess what the NVC said? We're retrogressed again. We're gonna be back 2012. And I know 20, I'm 2008. We're gonna go back 2007. So it's not your time yet. So now I got pushed back again. I already literally started telling my peers I'm about to head to the States in 2015. And 2015, they're like, "What's going on with your US? Are you just playing with
Making it
us?
up.
What's going on?
Yeah.
We're gonna give up your position. We're gonna give your position to someone else." I was like, "You cannot give my position to someone else because I'm still here." And they're like, "Oh my god, this guy." They thought I was lying or something. Because I mean, it's crazy to be going back and forth to that. And imagine the roller coaster of emotion of, am I gonna proceed or not? Right? At one point, I was like, let me just quit this altogether because I don't want this level of stress. I'm 26 at that time, 27. I have so much life to live in front of me. But then my goal, when I wrote down my goals after I graduated, I went back to it. I wrote it down, and it said, you will be in the US. That's your medium term goal by 30 to 40 years old. And you will be retiring between 50 to 60 years old, right? That was my long-term goal needed. I wrote it down after graduating because one of my mentors said, you got to know what your track on your
Mm-hmm.
professional career right now because you will get back to this. And sure enough, I went back to it and said, no, hold on. I'm not going to quit the US. It will come and it will come, but I will keep developing myself, right? And fast forward, I kept everything current. 2016, I was current again. I was like, is this it? Maybe this is it. Maybe it's gonna retrogress again. But sure, let me retake my IELTS because this is expired at this point, and then let me do my visa screen. It's the first time I did it, and finally I finished it. I got current June 2016. I was rushing to get the visa screen because it might retrogress again. Um, and finally, I got my visa screen September or October 2016, and documentary qualified shortly after that, and interviewed in December 2016, and got interviewed on January 12, 2017. All right. I already told my friends I'm going to be there before Valentine's, right? Well, guess what happened during the consular interview, guys? This is 2017, 10 years after I passed my NCLEX, or 9 years after I passed my NCLEX. I lost my passport inside the US Embassy in Manila, all right? They had me check in my stuff and they had me go out because I already cleared my bag. You cannot bring anything. I forgot that there's a USB wire inside my bag. It's for my charger. I cleared up everything. I didn't realize there's another pocket that was there. So I unconsciously left my stuff there because I had to go out and throw the USB wire, right? When I came back, the folder that's containing my passport was gone. And they're like, you didn't leave your passport here. I was like, I'm pretty sure I did because I didn't bring anything outside. And I was crying on the day of my interview because I'm so close to the American dream. Why can I not get there? Can we just be over this? It's such an emotional roller coaster for 9 years. I lost my passport on the day of the interview, right? But they were very, I mean, I'm the only one crying during the immigrant interview, and it's a formality at that point. Um, the ladies there asked, why are you crying? The lady that was processing my papers. I guess the crying worked because she's like, okay, we're gonna let you proceed to interview. Right? Normally we're gonna say no because you don't have a passport coming in or checking in. I already got checked in at the beginning. There's already a stamp on my passport. It's through the security that it got lost. Somebody picked it up, nobody returned it. Fast forward, I got delayed another 2 months. Finally, on March 2017, I landed in the US. Guys, the feeling was surreal. I'm like, am I dreaming? I told my friend to pick me up in San Francisco airport. That's my port of entry. Please tell me that this is real, that I'm not dreaming. I was crying the whole time because now I'm breathing the American air, the product of my dream from several years, my mom's dream for several years. It is actually happening. My mom even said, give up your American dream. It's not going to happen anymore. We just keep going back and forth to that. Let's all move on. But I'm not moving on to that. That's my job security. That's my retirement plan. And sure enough, came over here, passed through the immigration, and finally I felt like legitimate in the sense that my dream is actually happening and I'm not gonna make the most out of this because I have to wait almost 10 years. Roller coaster of emotions, guys. It wasn't easy, trust me. Many times I started to think I'm gonna quit. UK is there, Germany. I even was, at some
Canada.
point I was, I don't
Canada,
know how to
really.
say that, spiteful about US. Like, if you don't need me, then I'm worth more than that, something like that, right? I'm needed somewhere else. But hey, my petition was there. It's been approved all along. I'm just waiting for my time. That everything happens for a reason. I always put that in my brain. And another thing is everything happens at the right time as well. It cannot happen at the time that it's not right for you because it's just gonna mess up your life. So do I have to wait 10 years? Yes. But you know what? When I came over here, I got a game plan, right? Everything was clear to me at that point. I was 29, 30 years old coming into the US. I have a game plan. I know I wanted to do doctorate school. I know I wanted to be a nurse practitioner. I know I wanted to put up my business for NCLEX. I know I want to collaborate and network with global people advocate for IENs like me, and that's it. And contribute as much as I can to the government. I learned so much. Like Marvin said, the first year wasn't easy. For the first time in my life, in the first 3 months, right, I was ready to go home, guys. After 10 years of waiting, I looked at my bags and I said, I wanna go home. It's the first time I've been away from family, and I've been independent since I was 20. I've never lived with my family. But hey, during the weekends, if I want to visit my mom and my nephews and nieces and my brothers and sisters, I can just drive to them. But that's
Mhm.
not it in the US. There are 12 hours time difference, 13 hours. They're a 16-hour flight away. You have to plan your life ahead because, like Marvin said, you don't get your PTO on your first 6 months or 1 year, right? You
Yep.
you, you pick up whatever is left with the seniors. Seniors want, I want this weekend. Well, I guess I'm not gonna get that weekend, right? Because I'm the baby nurse in terms of American thing. But for the first time in 3 months, I got diagnosed with anxiety. My mom even laughed. You're just sad. I was like, Mom, it's a real diagnosis, okay? It's a neurotransmitter disorder. I don't want to get to the biochemical level of pathophysiology of anxiety, but I feel it, right? And shortly after that was depression. Do I have to be put on meds? I did, right? And there was one story in Lefora that I so relate to. And I don't want to divulge my medical information, but I'm telling you that these things are real. All right, I have to go through therapy and medications because I was so depressed. Um, I was contemplating about going back home because I don't know if this is for me after all these years. Have I grown out of it? The feeling of being in the US, but transition takes time. You are putting yourself in a new culture, in a multicultural environment. You are learning new things. I feel like my life, particularly my professional life, had to go back to start. In the Philippines, I was like this, right? Like I know a lot of people. I would go to places where people know who I am. I don't know who they are. And in the US, it's such a vast country that I felt like I was nobody. Like I was the bottom of the food chain. Like I don't have anything to prove in this big world, right? But I know my worth. I know what I had to go through. I know what I'm bringing into the table. So I kept going. I kept going. I didn't let these things that were scaring me to stop me because I know I can offer so much. But I made it my life mission after then to make sure that I put up my story out there, at least, just the superficial parts, at least, not very private stuff, but to tell nurses that these are real experiences, but we can live through it, we can go through it, and we can get past it. So please don't be discouraged with retrogression. It's a cycle, and because it's a cycle, it goes on and on and on. It will go away. It will come to pass, is what they say. So please don't get scared about that. All right. I'm going to take this time to answer some questions. Somebody asked, I think it's, where is it? Somebody asked, first step to become a nurse in the US from UK. Take your NCLEX and then find an employer to sponsor you.
Yep.
Okay. And do you have age limitation in hiring nurses?
No,
No age
no,
limitation.
Never.
no,
None.
As long as
no.
you
We
can
don't
walk into the
discriminate
nursing
age.
class, you can work.
Philippines
Swear.
only has the only discrimination for
Yeah, and also
everything.
pleasing personality in the Philippines only,
None,
but
yes.
like here in the US,
Yep.
no.
No
It's your
limitation
credentials that
here,
will
guys.
speak
You
for
can
you.
be
No
any age, you
height
can put in this.
requirement. No height
No height
Yep.
requirement.
requirement, no
No,
discrimination to whatever.
no pleasing
Right?
personality.
Yeah. Uh-huh. What state do
Oh
you
my
recommend
God,
for international
Marvin.
nurses? Anna,
I'm sorry? Uh,
is this state
Which
of
state do you
application or
recommend?
state to live in?
well,
Which
I'm gonna
state
be
do you recommend?
biased.
Yeah,
Of
New
course,
York.
New York will go in. Well diverse. I've been here for 8 years. I have never felt in my life, like when I was in the Philippines, doctors, professionals will make me feel like, yeah, you're a nurse, but you are just a nurse.
Right.
They try to make me feel I'm the bottom because I have a physical defect. I have a speech problem. And but in here, I have never felt that well diverse. It's not a perfect state, but I've been traveling for 4 years. I work with a lot of people, different nationalities, different hospitals. Like Marvin said, no discrimination, no matter how you look like. You know, there's no in a requirement for applying for a job. There's no number one, pleasing personality. That's what I
Exactly.
hated That's what I hated the most when I was in the Philippines. I am not joining Miss Universe. Why do I have to have a pleasing personality?
Right, right.
And they have no age requirement. The other day, I was so upset with one of the advertisement from a hospital. No, or nurses. You must be 46 years old back in the Philippines. Here, none. As long as you want to work and you're able to work, you can work. Even if you're disabled, you can still work.
Yes, that's true.
So I'll go for New York, well diverse, the city that never sleep, but this is not a perfect state, the patient of racial is not like California. Hate or California, they have a better
Our spoiled nurses.
yes. But if you're
They're
gonna
like,
work
why are
in
we
the
gonna travel
OR,
for 100 an hour? We're earning that in California. Okay, California nurses, I'm
yeah,
sorry.
yeah. So
Ahem.
but if you're gonna work in the OR, you're gonna have a one-on-one patient. But if you're gonna work in medicine, no, go to California.
Oh yeah,
Right, right, right.
thank you so much for the advertisement, you guys. But to be honest, like if you want to start like the first state to start, I would rather go to a state that has like no state tax, like
Right.
Texas and
Mhm,
also like
correct.
Florida. Why? Because like you're just starting. I'm fortunate that I started in Texas, so that's where I grow my roots, and then I realized that there are a lot of states where I can practice, and then I found my employer right now, my hospital of my dreams, who actually checks all the boxes. So as what
One
they
of the
say,
top
if you really
hospitals in the
want,
world.
if you really want to earn big, go to California. But before
Right.
going to California, my advice is wherever your roots, wherever is your entry, and my advice is to take a state that doesn't have state tax. That includes Texas or Florida. Start from
Mhm.
there, and then if you think that you are fit for a California dream, which is sub part of your American dream, then you are
Right.
all welcome to be part of the
Right.
California, the Golden State.
Right. And there's a lot to explore in the states. There's 50 states,
Yeah.
multiple cities, and
Yeah.
5 territories. There's so much. I've worked in Chicago and I said to myself, oh my God, I love Chicago. I want to stay here forever. Right.
And
And
then
it
you went to
started getting
Hawaii.
cold. And I traveled to Hawaii. I'm like, oh my God, I love Hawaii. I love it here. And then it's hot and humid all year round. I was like, I miss the cold. So I have to go back to Texas again. And I want to try many other states, but try what works best for you, because
Hmm.
the choice of where you want to work is highly individualized to your
Hmm.
situation.
Mhm.
True.
There's no one size fits all. Some people like to be in slower paced cities, the burbs, or the
Mhm.
rural Americas, and that perfectly works for them.
Yeah.
But some people likes to be in urban cities. That explains why Marvin is in San Francisco and Anna is in New York, and Dr. Nurse Paul is in Houston, where we all drive like crazy anyway. So um, we love the thrill of being in the urban community where your Walmart could be 1 mile away, but you have to
Yeah.
drive 30 minutes. Sure, why not? Right? We love it, but that's what applies to our current situation. I'm still based here in Houston, Texas, but I travel for work. I travel for leisure as well, but I also run my business here for, I guess, financial reasons. And that's it. But truly, there's so many places to go to. I've been to New York, San Francisco. I'm a city boy ever since. I love looking at landscapes. Definitely, these are the best cities. Those
Mhm.
are in my top favorite lists that I would go to any day. But find what works best for you. There could be a better opportunity in another city for your certain specialty. All right, because each specialty have their own thing too. But there's so many states to choose from. Really, really, so much opportunity. You can literally quit your job right now and move to another job. Right? This is almost 2 hours, guys. But I'm enjoying. I'm sorry. I hope I'm not taking away your vacation time, Marvin. Um,
Mhm. No, 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 it's fine.
but this retrogression mean that would probably take a lot of years too. It's hard to tell at this point because
Hmm.
this
We
is
don't
the
Mhm.
first
know.
retrogression since 2019. We're gonna have to check the pattern, is what I'd say. What about you guys? What you guys think?
Yeah. It's very unpredictable. So the only
Unpredictable.
thing for
Very.
you to do is like check every monthly bulletin. So that's the
Right.
only way, because like we don't have the crystal ball to tell you like, hey, next
True.
week will be like current, next month will be like this, or going back.
Mhm.
So no,
Right.
it's actually like no one's ball game right now.
Right. Thank you.
It's
And
like
let's.
a
Yes.
love life. You don't know who you're gonna end up
Yeah.
with.
All right. And sorry about that. I have a class at 10. Sorry. They're like, sir, your Zoom is already live. We're waiting for you to come in. Yeah, I have 20 more minutes. But I do classes every day. Guys, yesterday I did 3 classes at 1 a.m. to 5 a.m.
Oh
and then 8
no.
a.m. to 12, and then another class at 8 p.m. to 12.
You are the
But
winner.
because it's international classes, so the time zone is different, but I have to adjust to my students everywhere too. But that's for my NCLEX review. Um, but yes, Marvin and Anna, can you share last few words to nurses to encourage them to, do not give up on their dreams and will have to live through retrogression? What you guys can tell about that?
Go ahead, Miss Anna.
Okay, so name first again. So I know I've been very open with my experience in Refora. So I'm gonna say again, look at us, look at me, look at Marvin and Paul and Yanni and other admins. We are the living and active testimony of retrogression. We've been there, done that, we experienced it. If we listen to the naysayer, for your unsupported friends or neighbors or family who keep telling you, are you sure you have an American dream that you're waiting? Are you sure you've been spending a lot of money, spending a lot of effort, spending a lot of emotion on your American dream? Are you really sure you're waiting for something? And my answer will be yes. Because if I gave up when I failed IELTS 5 times, if I gave up when my Earth agency abandoned me because of retrogression, I am now gonna be here in New York. Guys, I'm telling you, I am not very, very rich, little, but I all knows this. Oh, when I met you personally, I told you I am so grateful that I came to US. I'm so grateful that I never quit, I never gave up even though there's so many heartache sacrifices, there's so many people telling you to give up. If not, me and my husband and my daughter will not have this kind of life that we've been dreaming of. Now we're able to buy, eat, go places that we want to, see concerts, you know, live the best life. This is what I've been praying for when I was
Work-life
in the
balance.
Philippines.
Mm-hmm.
When I was having a hard time being a Filipino nurse, earning $200, and now I'm able to help some family members, friends. So please, this progression, I'm not saying ignore it. It's understandable, but take a break. It's only a break, Before you know it, you're already been here, and looking back, you're gonna realize, oh God, thank God, I never gave up. I never stopped pursuing it. So like what Paul said, continue, review at your NCLEX, your English exam, learn, find prints, find like what Marvin said, especially cooking, he's right,
Will come
writing,
handy.
hmm learn those things. Because right now, learn the immigration processing, your rights as an immigrant.
Miss
Sorry, I
Anna.
think
Miss
Anna,
Anna.
I think
Miss
you
Anna.
got
Miss
muted.
Anna. Miss Anna, we are losing you.
She got muted. There you go.
So that's what I was saying. Don't give up. Take a break. Take this time to learn other more important things. Right now, you're having tunnel vision. You're like, oh, retrogression. No, there's more to that to learn. And I always say thank you at all, even if it's always last minute. I always have
I know,
fun.
I'm so sorry.
Don't worry, as long as I'm okay, I'm available. I'm always gonna say yes. And Marvin, thank you so much for your colorful experience.
Right.
My not permanent friend. And just keep tuning in the aura. Now we have the aura. We have for Paul who will always help and support and inform us during our time. We don't have this. We have no emotional support. We have no social media account. So make use
Right.
of this time.
Right.
Okay.
Thank you. How about
Thank
Marvin?
you. Thank
Okay.
you.
So for me, I to all the foreigners out there who are also in doubt about retrogression, I was once like you guys. I was a
Mm,
trailblazer. I passed the NCLEX, I studied, I focused on these goals. However, there are things that were beyond our control. Okay.
Mm-hmm.
Success takes time. As what they always say, patience is not the time that you waited. It's not the amount of time that you waited, but it's your reaction and what did you actually do with that while waiting for those moments. Now, to be relatable, I want to say this. It takes time for Michelle Yeoh to win the Oscars. It takes
Mm-hmm.
That is true.
several nominations for Leonardo DiCaprio before he get the Oscars.
Right.
It takes Catriona and Pia Wurtzbach to join beauty contests again and again just to win. If they
Right.
give up the first time that they were denied, we won't have
Mhm.
Miss Universes. We don't have Best Actor Leonardo DiCaprio, and we don't have the I think the first Asian Oscar winner to be awarded. So everything takes time. So that's what I always say. Your dreams, your American dreams, it will never be denied. But it's just grooming you up to something better. So use your time well. Use your time well to develop your skills. Use your time well to devote it with your family members and your friends. Because time once lost can never be recovered. I
Mm-hmm.
know this is true to retrogression, but again, you're never being denied. You're just redirected to something that is better. Who knows? One of these days, you'll be the one sharing this story to us. So just be
Mm-hmm.
patient, use your time well, and always have that hope, a beacon of hope. And for sure, everything. Everything's worth it takes time. Thank you so much, LaForest, for
Thank
sharing
you,
for hearing
Marvin.
my
Thank
story.
you, Anna.
Thank you so much, Anna, and thank you so much, Dr. Paul. And this is Marvin, live from Vancouver, Canada.
Vancouver. We gotta miss Vancouver. My best friend is there. And Anna, thank you
I'm
so
New
much as
York.
well. We have to visit New York. We have to visit Anna.
Yeah, sure,
Um,
sure, yeah.
thank you, guys. And they are right. I want to affirm what they said. American dream is real. Do not give up. This is just certainly just another hurdle, just another obstacle to go through. But guys, eyes on the prize. All right. Be
Mhm.
patient. Success is waiting for you. Success comes to those who wait. This is what we say. But you guys have to be very patient. Do not give up. The minute you give up, that's the minute you lose. All right. So it doesn't matter if it takes you 1 or 2 years or 5 years or 10 years, but if it's for you and you keep persisting towards that goal, it will happen. You will make it happen. Believe in yourself. Temporary obstacles might cause you temporary pains, but it should not deter you from your motivation to do this in the first place. You will get here. Trust me, these are lived experiences of Marvin and Anna and myself who've gone through recession, retrogression. It's another recession is another. But that's it, guys. Thank you so much, Anna and Marvin. And
Thank
now we'll
you,
proceed.
Thank
guys.
you. Thank you.
Thank you. And now we'll proceed to plugging my activity for the Nurses Month. Guys, upcoming this month for the Nurses Month, I will be launching the Dr. Nurse Paul and Aspire RN virtual job fair. So we're going to do a virtual job fair, which is going to be happening every Wednesday of May 2023, every Wednesday, 8 a.m. Central Standard Time. This is on top of the Dr. Nurse Paul show every Saturday. So now we're going to do two shows every week during the Nurses Month on May 2023. So that's going to be Wednesdays, virtual job fair. This is the best time for you to communicate, ask questions to these recruiters. And we have our major sponsors right on the screen right now. Kinetics USA, PRS Global, Worldwide Health Solutions, and Advanced USRN are going to be part of this. And also to our other sponsors, Grandison, 9.09ers, The Choice is Right Customer Service Assistance by Miss Anna, our guest today, Eplex Pro, Global Care Services, and the Travel Nurse Hacker. Thank you for our sponsors. But guys, look at the QR code right now. Click that link and register so you can join the virtual job fair. We're going to give out tons of prizes from free NCLEX reviews to free UWorld subscriptions and free English exam reviews, plus a lot more coupons, discount codes that you can use to our providers and vendors. So guys, please join us on the virtual job fair. This is exciting. It's the first time I'm doing it, but I'm really excited to bring all these employers so you guys can ask questions. Is the retrogression going to affect my recruitment? Certainly not. There's a lot of jobs waiting for you. Tell your friends about it. We're going to be giving a lot of prizes as well this coming Nurses Month. This is to honor you guys, nurses, and of course, to bridge you to your American dream. So please join us, virtual job fair. And next Saturday, I'm going to do another show. That is going to be the show that I missed last week. It's the Secrets of Next Generation NCLEX partial scoring system. I'm going to walk you through, guys, how scoring system can affect your performance in the next gen NCLEX. Will it be better? Will it be bad? We'll learn next week in the Dr. Nurse Paul Show, Secrets of Next Generation NCLEX. This is perhaps the longest show that I did, but thank you so much, guys, for tuning in. Please continue to support Dr. Nurse Paul Show, and please follow Miss Anna and Marvin in their own journey as they share it through their social media pages. Thank you, guys. You have a great weekend. See you in the next Dr. Nurse Paul Show. Bye.
You have just watched the Dr. Nurse Paul Show. Watch us live every Saturday, 8 a.m. Central U.S. Time. For more info about our future events, follow us on our social media channels. You can find us at Dr. Nurse Paul on Facebook, Instagram, TikTok, and YouTube. See you next week.